Fidelity came out with a study that said the average retiree is going to spend more than double on healthcare cost and retirement than what they expect. In fact, the average cost for a 65-year-old in retirement is expected to be $165,000. In this video, we're just going to break down that study, show you how they got there, and give you some ideas for how you can kind of plan for your healthcare cost and retirement. Now, my name is Scott Caulfield. I'm a CPA and CFA charter holder and the founder of Sophos Wealth Management. Now, first of all, this study, in terms of what they're looking at, it's important to know they're excluding certain other healthcare related costs. So, any over the counter medications, most dental services, long term care are not going to be in here. Now, how do they get to the actual $165,000 estimate? Here's a great chart kind of showing how this breaks down. So, 43% of this is coming from your premiums. Those are Medicare Part B and Medicare Part D premiums. The other 47% are going to be your other medical expenses. This is your co-insurance, your co-payments, your deductibles, hospital visits, so on and so forth. That's obviously going to be a pretty big variable component as well. And then the last 10% is those out-of-pocket prescription drug costs. The one part it's pretty easy to kind of plan around is those Medicare Part B and Part D premiums. Especially this is going to be an income related thing. There's the income related monthly adjustment amount, or commonly known as IRMA. This table will kind of show you how that breaks down. So for those of you making 106,000 or less, modified adjusted gross income as single individuals, or 212,000 or less, there is no IRMA premiums. You're just paying that $185 a month Part B premium. But as your income goes up, you can see those Part B and Part D premiums continues to go up all the way until the highest bracket. Pretty big monthly adjustment amounts. So $443, almost 444 for Part B on the highest bracket, and another 85, almost 86 for Part D. That being said, for those under 65 without Medicare who are paying out of pocket for healthcare, that might actually seem like a bargain. But nevertheless, I mean, that's the one component we might have pretty good insight into. Much harder to project out what your other medical costs are going to be, how many hospital visits you're going to have, what kind of medical conditions or pre-existing conditions you have versus might have in the future. Now, how does this come out to be double the expectations? Well, part of it's just based on a survey. It was over a few thousand American households, and that found that the average retiree expected to spend $75,000 on healthcare costs. I will note that healthcare cost is about the only expense for the average household that goes up for households over 65 versus households under 65. Almost every other cost goes down for the average retiree or retired household versus, say, working household. So hopefully you can kind of incorporate that into your planning and make sure you're not planning on too low of healthcare costs. You don't want to get caught kind of hanging out in the wind, spending way more than you expected and not having the assets to cover it. So hope you found this video useful. Encourage you to like it with anybody you think would benefit. Subscribe to my channel, and appreciate you tuning in today.